Hello, my name is Dr. Catherine Antley. I'm a community physician in Vermont, and we're doing another episode of the Science of Effective Prevention. And today we have a special guest with us who's visiting us from Massachusetts.
My name's Judith Margulies, and you can call me Judy.
And Judy Margulies is a registered pharmacist in Massachusetts and Vermont.
Yes.
And so she's going to have a perspective on what's happening in Vermont that will be unique. The first part of this program, we want to talk about media matters. So what does that mean? What we're thinking about media matters is there's information that we know is true, that the Department of Public Health and the Department of Mental Health in Vermont have been putting out on a regular basis. But surprisingly, our local, the Burlington Free Press, the Vermont Digger, and the 7 Days, and many other newspapers around the state have not covered this information, and it's of great concern. So the first thing I want to talk about is there's a community of prevention professionals in Vermont. These people know more than you or I or almost anyone in this state about prevention. What do they know? They know what works and what doesn't work. They can separate the myth from the science. And they've been following the discussion in Vermont, and in Massachusetts, we had a situation where legalization of marijuana was advanced because of social justice and criminal justice reasons. And in Vermont, we're having a legalization, or rather commercialization of marijuana.
Commercialization, yes.
Is being advanced, and they're using the rationale that we need money for prevention. The prevention professionals in Vermont are very concerned about this, and they've issued a press release, which is 2 pages. And the title of the press release, it's really very simple: commercialization is not good prevention. So this press release was sent to every media outlet in the state of Vermont that's well known. They sent it to the Free Press, they sent it to the Digger, they sent it to the 7 Days, and effective prevention does not include commercialization was not picked up. That story was not run. In fact, the press release was not even published. So do you want to talk a little bit about that, Judy?
Well, it's not surprising, actually, to me that that's happening, because it's really the same thing that's happened in Massachusetts to a large extent. The Boston Globe, the papers, the television press, we're not hearing about the specific aspects of prevention and the trying to balance promotion of the industry, which is really what's happening in Massachusetts right now. The Cannabis Control Commission's mission is to actually enable and promote the industry, to the extent that we actually have billboards throughout the state going up that marijuana is legal. So any reading 7 or 8-year-old is seeing publication of basically the program. But when you talk about prevention, it really is those tenets, and it's totally inconsistent to think that if you expand an industry from what is presently exists in Vermont, which is it's a legal industry because people can grow their own, they can possess small amounts. So what the intention is here, from what I understand and what I've experienced, is the legislators are talking about creating a commercial industry, and this really would be encouraging the high THC products, the ones that are the most dangerous. And those individuals at a very high rate, some people actually say 100% of people who are using these higher THC products daily are going to 100% will go on to have a substance use disorder. And in primary prevention, what we would be doing is trying to decrease the use while it's being encouraged. It really goes against everything we are doing for every other drug,
right?
Whether it's alcohol or tobacco, it's just doesn't make any sense.
That's right. I mean, that's the core message, and we've talked about that a lot on this show. But what I wanted to emphasize today is that every single prevention, 100% of the prevention coalitions in Vermont have signed on to this press release, and yet the press release was not published in any of our publications. And it's the same message that folks who've been watching this show know. a small percentage, 20% or less of the people consume 80% of the product. So an industry is really interested in creating these heavy users, and they do that by targeting children, and they do that by producing a very concentrated product, and we've talked about that in the past. So I want to go on to another aspect of Media Matters. And that is, we've seen, this slide before, and this is the idea of psychosis, right? So let's think about, we've talked about psychosis on this program. We've talked about the idea that we know that no serious scientist would continue to dispute the fact that marijuana is a component cause of psychosis, just like sugar is a component cause of diabetes, and that therefore the idea is to reduce use and not encourage use. And so the disconnect, in other words, there haven't been any articles to speak of. We haven't had very many articles in the Free Press or the 7 Days. We haven't had very many articles in the Vermont Digger talking about what's going on with psychosis. Is this real? What's going on with suicidality? Are people really more likely to have suicidal tendencies? Are they more likely to complete suicide? Are they more likely to go into depression when they stop using marijuana or when they're using marijuana? Is this real? And the health department...
That actually, if I could just jump in, that actually really surprises me. It surprises me that you've actually attempted to get the information out there. And it is real. I mean, we all know that. Based in Massachusetts, we know that there's been many incidences of psychotic effect, of incidents where there's been deaths involved. I think there's something going on right now in Vermont in terms of consideration in the legal system. So why isn't the press
picking up on
it? Because there's even been a best-selling book written on this topic.
Right. So we've had discussions with I know the Commissioner of Health has weighed in on this, and he's testified a number of times that clearly high-potency marijuana, which is more than 10% THC, is associated with psychosis. And he has, or they have, the Department of Health has issued this memorandum, and the memorandum has talks about psychosis and mental illness. It talks about suicidality and mental illness, and this was released to the legislators, but we have not seen significant coverage in the media. We had one Vermont edition that was just recently. Jane Lindholm, I think, for the first time, did a 7-minute episode, 10-minute episode with Dr. David Ratu, who's a child psychiatrist at UVM, and they went into this, but they didn't talk about how commercialization would make the product more concentrated and more dangerous and more available as the perception of harm goes down. So
May I comment on that for just a second? Because actually, I just actually have seen this, but what stands really out here is that the Department of Mental Health in Vermont is saying that commercial cannabis sales will have an overall mental health negative effect. And what also really stood out to me, because we know in Massachusetts that we are estimating that it costs $50,000 to $100,000 a year. And economic impact for each individual who has a substance use disorder. And that's really what we're talking here with the heavy use of these heavy or high THC products. But yet the Vermont Department of Mental Health goes on to say that the major costs that are going to impact the communities from this will consume a significant portion. The actual administration of the program is going to consume a significant portion of any revenue gained from taxation. So there really is, from the administration's perspective, no benefit from taxes. It is going to just be consumed by those impacts. Treating substance use disorder. What else? Policing.
Sure.
I mean, local policing will have to respond, because this isn't something the federal government's going to come in. If people are, using 89 and 91 as trails connecting Canada and Massachusetts together, whether it's cartels, we know the cartels are involved in this industry. This is a commercialization.
Right, it's not two plants at home. So this gets at that question of taxation. This is shows Colorado was, they passed commercialization of marijuana in Colorado, saying the money taxation is going to go towards children, towards pupils and education. And what we see is over time, their per pupil spending has gone down, and in comparison to the rest of the country, it's gone down substantially. So that hasn't really worked out for them. But what I really, really wanted to focus on was this idea that even though the Department of Health has issued this statement saying psychosis is linked to marijuana, we haven't seen it picked up in our newspapers, and we find that extremely concerning. So the next thing, they also mention this in this article, is suicidality. And here's a graph of marijuana associated with suicidality, and you can see that in Colorado, as they did the Cole memorandum, as marijuana became more available and legal, their suicide rate went up. So we do definitely have a link. There's a number of very well-done articles that look at this in terms of causation, not on a societal level, but on an individual level. And here we also see that when someone has used marijuana, their risk of suicidality is much higher. Mm-hmm. And we also know from the National Academy of Science that in 2017 they issued a statement: heavy cannabis users are more likely to report thoughts of suicide. So this is important for Vermont to know, but they're not being informed by their media. And that's why Judy and I are here. Why I asked Judy to come and so that we could talk about this a little bit.
And it almost sounds like it's unbelievable that we'd even, there are 10 states currently which means 80% of the United States actually don't have a commercial industry. So this is not an inevitable thing, which is another thing I continue to hear. This is inevitable. Everyone's doing it. Well, that's what I believe lobbyists may want you to think. But it's actually 80% of the country does not have a commercial marketplace. So where would that actually leave Vermont?
So let's talk about what happens when people are suicidal and when people are psychotic. Because we have a lot of examples. Right now downtown, we have a fella who apparently, allegedly, I don't know the specifics of the story, but there was some mental health disturbance. He presented himself to the ER, I think 3 times in the morning, and that afternoon was so perhaps allegedly suicidal that he got in his car and drove the wrong way down the highway and killed 5 young teens. His THC level was very high and was indicative of high potency use, high extended high potency use, and so these things have. Suicidality has an impact for the individual, for the family, and for our community, because especially in this instance.
And there are a few examples actually from Massachusetts. That one I'm familiar with. These were 5 or 6 teens. I believe there were 6 teens in a car. The only survivor was the driver. The only impairment was marijuana impairment. High speed in a residential neighborhood, and that is the car that they took the young people out of. These were just teens, 17, 18, 19 years old.
And this disproportionately affected minorities, I think.
Yes, actually, yes, that's true also. Because in Massachusetts, there is this concept that this is going to be a social justice. It's going to compensate for the harms of the past. But yet what we're finding is that the only communities that are really embracing this are the more densely populated ones, which happen to be more people of color. And those communities are going to be the communities with the most retail operations. But yet we really can't underestimate the impact of all the other things, because I think that some people have an impression that it is the retail operation, that's the retail store, that's the dangerous piece, when in fact every piece is. There's tremendous impact on the local.
So let's talk about some other things that happen when people are psychotic. I just want to run through this because it does impact us here in Vermont. We had someone jump out of a 4th floor window in South Burlington. He was psychotic. on marijuana, only marijuana. He was holding his young son clutched to his chest, and he was apparently in a marijuana-induced psychosis and anxiety attack. And so that they miraculously both survived. And you know, when I think about that, it concerns me that the discussion in the courts and in our community is around that fella and that particular situation. But why did that young dad, who in all other, you know, indications was a good dad, why did he think that smoking marijuana, high potency marijuana, would be harmless? Why did this good person who had a little child he wanted to take care of, why did he think that was harmless? And are we not paying attention to, as we said, the health department when we read what's in the paper or you know, ask our editors what they're publishing? Let's go through some others. South Burlington High School senior, apparently paranoid, sends death threats to teachers and fellow students. He tests only positive for marijuana. You know, we have a Vermont mom, THC positive, accidentally, inadvertently smothers her child. So these are not bad people. They're people who have been misinformed, in my opinion, just like the smoking industry, the tobacco industry was responsible for the 400,000 people who died of tobacco cancer, or to any other tobacco-related illnesses. We need to hold the people who are telling us this is benign and not harmful accountable.
If I could add, though, at the State House, I know I've seen plenty of industry lobbyists there because I just went up a day or two. And I would really encourage, one of the things that I think is very, very important is that the residents of Vermont actually speak directly to their legislators. So I actually have written down that telephone number of the State House. It's 802-828-2228. So it's 802-828-2228. And we'll probably repeat that. Your legislators do need to hear from you because it's obvious that media does matter. And if the media is not telling you this, then you need to question your legislators and find out exactly what's going to be happening in your own local community. I also think it's probably important to also mention that, you know, it's very easy to listen to our conversation and go, geez, I smoked that back in the 70s, or I know someone who does this occasionally. The reality is that the marijuana today, you can hear this from any physician who works in an emergency room, that the marijuana today is literally a new drug. So I had actually said it to one of my sons. I said 15 years ago, what you may have experienced in a casual way in college is actually different also, because in the last 5 to 10 years, we have increased the concentration of the flower at least 10% from 10 times what it was in the 70s. 1 to 2.5% is now 25 to 30% flower. And also where a lot of the money, they believe, is in these designer products. And the designer products are in the ranges from 65 to 98% THC. So we're really talking about taking the equivalent of 35 puffs off of that same joint that someone back in the 70s may have used. That is something that individuals must really recognize here, is that this conversation is really about a new drug that is causing people mental health issues that really has a significant impact on the community.
I've heard one high school in our state has had a 10-fold increase in the incidence of severe psychosis, and it's often linked to this high potency that has been coming out of diverted, reportedly or allegedly, from the medical marijuana industry, but also probably illegal. So that's important to know.
And then just the incidence of how often youth are using it these days.
Right.
It's apparent that we're normalizing it, that we're accepting this as just normal. Everybody does this, it's inevitable. When in fact, what that is, the message it's giving to youth is the wrong message. It's the anti-prevention message. You don't normalize drug use, because when you do that, you give the message to youth that it's okay for their brains that are still developing to use a drug that's going to actually harm their brains.
Right. So thank you very much for joining us to talk about Media Matters. We just
You
wanted
gave me the last word, almost.
touch about on some of the topics that the health department is putting out, and the professionals who are respected professionals in prevention are putting out. I wanted to make sure that the people of Vermont had a chance to hear that. So thank you very much.